Hi, welcome back to the As a Matter of Fact podcast. Today's episode will be the crazy medical stories.
Oh my god, baby, you're standing!
This 3-ton man was taken to the hospital with severe stomach pain,
We're gonna need a bigger hospital.
even though he had not left his house for 5
But why you got to roll like that? Like that was so unnecessary. Just now, let me take a pause. The roll. It just caught me off guard.
beautiful wife.
Hun, I'm fine. She likes to make mountains out of molehills, and I'm already a mountain.
The doctors quickly started running tests, but the thick layers of fat made it impossible for a regular X-ray to scan his organs. So the hospital had to call the zoo and borrow a rhino X-ray machine.
After the news, I just had to call. The news? We're gonna have a baby, I'm pregnant? How? I mean,
Wow. Yes.
She does all the work.
But how? This is the wife.
no.
And this
Don't do that.
Is
But their laughter was overheard by the wife.
There are some logistics involved. You want me to tell you?
Yes.
Soon the test results came back. Corso's infection was very severe, and considering
what is his problem? Like, why is he there?
I don't know. Probably, obesity related health complications.
Okay.
But I just couldn't get over the role because who falls like that? It was like, you know? Well, Chanel here trying to figure out the logistics. She really wants to know how that happens, right? But in all honesty, it is wrong to be rude to patients. I mean, we might have thoughts, right? Because sometimes they'll come in with some things, right? And we have some questions, but it's not right, to say it. Always stay professional.
Of course. And we always say we don't judge here. No judgment.
No judgment.
Whatsoever. We don't know why he rolled like that. We don't know why he just flopped like that. But, actually, obesity is a big problem in Trinidad and Tobago. We have a terrible diet, very poor diet.
That is very true.
Overall. So I've seen cases where people are very obese, and there's also a case that we dealt with, or I saw, where the patient was too big to fit inside a CT machine, and things didn't go too well after that. So I think that you need to, be conscious of what you weigh. A lot of times, not a lot of times, but sometimes the issue is like a medical condition. Sometimes people don't choose to be a certain way. Sometimes it is a choice, but I think that with discipline, with proper counseling, with proper knowledge, people could lose the weight that they need to lose.
Sometimes heart disease does not run in the family. It's just that the family doesn't run.
Whoa. Oh, okay.
Oh. Okay, so hopefully that never happens to anybody, but just in case, just so you all know, if a doctor comes and they have to draw blood from you, just know that what we call the tourniquet, they might use a glove, they might use a strap. That's just to stop the blood flow, just so that your veins could fill up so you could get the blood sample. So whatever they tie around your hand, just know that it's supposed to come off. Okay? I mean, unfortunately, there has been some stories out there where a doctor accidentally left a tourniquet on. So it stopped the blood flow, no oxygen to the limb. It's a disaster, right? So just in case, God forbid, just know to take it off for yourself if you can, or just to remind them.
Or call for help or something.
Just let somebody know. Just don't leave it there.
Also, if you see a doctor coming to you like that, I mean, I would probably ask for somebody else.
And you can do that.
Because there are people who pretend to be doctors, huh?
That's our own nation. crazy medical story, you know. I mean, everybody wants to be doctor, you know, but you can't just show up to the hospital and call yourself. And you know what's crazy? I mean, it was like a dead giveaway. I mean, there's a lot of doctors in a hospital. Everybody doesn't know everybody, obviously, right?
Right.
But like, homeboy came with like San Fernando Hospital. And
I actually don't know this story.
and he had like a white coat,
A
long,
lamp,
long white coat, and it had like detailed descriptions like San Fernando Hospital doctor and general whatever, and it's like real written out. He needs to be known, and it's like we don't do that.
But
We
the
don't
next
do
question:
that.
who actually wants to go to the hospital to work and not make money? Like you just going there for what?
Vibes,
I know you lying.
because he was
I'm
be a
not vibes
doctor.
That is not the kind of vibes.
He always
that-
wanted to become once he wanted to get the feeling.
Really? Or you just saying that?
I don't know. How I could know crazy people?
I don't know.
But that was something.
This stethoscope doesn't work. Sounds all right to me.
Obviously.
What is the moral of this story?
So the moral of this story is stethoscopes that we have here, right?
Yes.
Is to listen to your heart songs, right?
All other organs.
And
Not
other
just-
organs,
not just the heart.
but pertaining to this video, listen to your heart songs, right? It is heard on the left side of your chest, you know,
For normal
and-
people.
from normal people, and usually you hear what we call the lub dub song. For normal folks, if it goes a little abnormal, that's when you say you have an abnormal heartbeat or you have arrhythmia, something along the lines of that, right? But we all know for a fact that if you hear nothing, you're dead.
There have been times where I had to listen to a patient. I'm like, is it my ears? What is happening? But just listen properly and clean your ears. No, don't cut that down. Cut that out.
And sometimes, like, you don't even need a stethoscope. Like, if you lay down on someone's chest, you could actually listen to their heartbeat. You know, it can be comforting to make it feel it as well. If you like place it underneath, yeah. So just to check to make sure that you're not dead.
You don't have to check. I mean, once you want to check, that means you're good, most likely.
How's my son?
He's going to be all right.
Oh,
Thank God.
finally, some good news from this guy.
take that.
That's a great attitude. I gotta tell you, if I was getting this news, I don't know that I'd take it this well.
But you said he was all right.
Yes, he's lost his left hand, so he's going to be all right.
You son of a bitch! I hate this doctor!
He's a very literal man. Yes, come here. That's more the way I would take the news.
Oh, this guy again.
How is he, doctor? It looks like he's dead.
Oh my God!
Oh, little guy. The tears aren't coming. The tears just aren't coming.
Just to be clear, it looks like he's dead or he is dead.
It just looks like he's dead. He's got like blue paint on him or something. But he's going to be fine.
Doctor!
Well, we actually thought how to communicate appropriately and professionally to patients to avoid anything like this. But also, I just want to encourage people, if you don't exactly know what your doctor is saying, you can tell them, you know. Tell them that, you know, simpler terms that everybody could, you know, retell to somebody else just so that you understand. Because I don't like when people leave the hospital and they don't understand what is going on with them. Okay, so just clarify. It's okay.
Something just definitely wrong with that doctor, though.
People real?
Big stripping, man. Who is a kid? That's a kid. That's a kid.
Are you going like a cat?
Are you afraid of needles?
I actually am very afraid of needles. I'm okay with taking blood from people, giving them
Of course.
drugs and whatnot, but to like actually get stuck, I need to hold somebody's hand, my eyes need to be closed, I need to be comforted. It's a whole thing.
Comforted.
Yeah, I need to be comforted as well.
I mean, I don't mind it, but it's like a sting. It's just like, oh
No,
grief.
it's like it's a real phobia. Like I actually don't like the sensation of the needle being in my hand. I don't like it, and I understand why. I understand, but I think the worst part is the anticipation. It's not the actual stick, but the anticipation is terrible. I don't like it. I don't like it either.
I have a confession. Like, I always be like, you know what? I'm just gonna pin an IV. It's fine. Like, why you getting on like that? I never had an IV.
Oh, the deception. The betrayal, man. You deceived me.
Sorry.
So I literally
No,
do
yeah.
not know.
That is true.
You
You know, you go to patients, just an IV, and then
like, why you getting
explain
on
to
like
them.
that?
But I don't want one.
But it's necessary. It is needed.
For sure. For
Sometimes
sure.
when don't fight us, please.
No, I mean, if I need one, obviously I'll hold somebody's hand or something. I'll take it. Luckily, I have some good veins, but I'm not getting that if I don't absolutely need it. No.
Confessions of a doctor.
Oh. Oh.
She can move. She can move after it. I support this.
No.
I support this wholeheartedly.
What if she didn't move?
Because sometimes, right? You come in and you be like, okay, how much pain in? Don't get real bad. It real
Oh
bad.
my
I say
gosh,
a scale
that
of
is so
1 to
true.
10. You know, we have thought of the scale of 1 to 10 into range pain, right? The scale of 1 to 10. 10. I say in pain now? Yeah. What number? 10.
But no, 10 is like you're on the ground, you're rolling, like you can't even talk. So we know when you say 10, it's not really 10. But I have a story. There's a time I was I on call? Anyway, I was called to the ward because this patient was complaining about severe pain. Like the nurses called me, like I need to come and see this patient now. Anyway, I go to the bedside. She's eating KFC in the bed. I'm like, they told me you're in severe pain. Yeah, doctor, real bad.
And what did you do for your patient who's in severe pain?
My goodness. What did I even do? I maintained my composure and I said okay, and I just gave her a painkiller. I think I gave her a Panadol or something. Because it can't be that
Something
you're
weak.
eating KFC and your pain is 10 out of 10.
Real bad.
Yeah. But I mean, I didn't ignore her. I acknowledged her pain and I gave her something for it. You know? But come on, man.
Stop lying. Like
Yes.
honestly, like we have things to do. And if you know you're not that serious, I mean, if you're saying that to get attention, try to beat the system, right? Whatever. But you're not dying.
I mean, I understand that you know, like you really need some help and people not taking it on, so you say that, but you can't be eating KFC. Like I know.
You have to commit to the act, right?
Yes, commit
Like,
to the act.
even if you sit down now, maybe see them come in, or you be like, oh God, dog, how it feels so long, you know? Like commit to snap. So when I rotated through urology, which is like the study of the urinary system, right? There was this patient that came in for something called epididymolysis. Basically, that is inflammation of the testicles. Overall, his balls was swollen and in pain, right? And it's like, okay, I understand it's extremely painful. I get that. I mean, I don't have any, but I would imagine it's bad, right?
Okay.
And it's because The doctor that reviewed him already went through everything. That's fine. I'm probably just passing through. I was on a team, but I did not have to review him.
Okay.
He's just like he came in, he just wants so much sympathy, and he's just opening it up. Talk, look, see, look at this. I'm like, yes, I understand. I do understand.
And he was like seeing it. Oh my god.
Yeah, he just opens out. I need to see everything. I was like, I don't need to see your balls. All right. The next day come by, he come. Look at big, look at small. Oh.
This is his manhood. Like
I understand it's scary. Like that's your precious jewels, but at the same time, y'all just be real comfortable. I understand. I mean, I understand wanting sympathy.
I'll give him a lie.
Oh, yeah, but my eyes, like I don't let me see things that I don't necessarily need to see. Because like I have some people, like some friends that have the belief that because, we see some strange things and we have to do some strange things that most people don't normally have to do. It's okay to tell us certain things. It's okay to be open and show us some stuff. And I was like, yo, I don't want to see that.
I know who to not tell my problems to. You don't want to hear about my hemorrhoids?
No, I would like a break. I would like a mental break. You're not my patients. So why are you coming to say? I guess it's a comfort thing for y'all, because you just feel like it's okay.
I don't know. I like when my friends, my family ask me about medical stuff.
When they ask like genuine questions, like genuine problems, like you really want to solve it, that's fine. But if you're just calling to tell me that your booty hole is hurting and how
okay. I see.
That's too much detail. You know?
Mm-hmm. For sure. Like if I can't genuinely help you, like you don't have to tell me.
Yeah.
Thank you for being there. For the surgeries and the rehabs. I wasn't always the easiest person to be around.
We're not arguing that bad.
You should tell that to my ex-girlfriend.
Look,
Sorry.
Hey, she just wasn't the right fit. You'll find someone new.
Sorry,
Okay?
Here's what happened.
What? With the coughing and the
coughing.
Oh.
Oh no.
What?
911, what's your emergency?
R.I.P.
He didn't die.
Oh.
He didn't die. I used to watch that show. Anyway, he basically had something that we call a pulmonary embolism, which is where you have a blood clot in your lungs. And unfortunately, it can kill you. But symptoms are usually, most of the time, it's just like you have some shortness of breath or a fast heart rate. So sometimes you won't even know that you have it. Or you can have coughing up of blood. I've actually never seen that. Like, of all the pulmonary embolism cases I've seen, nobody said, oh, I coughed up blood. But it is something that if somebody tells you that's what it did, it's like that's one of the first things that you think about.
Oh, also, a sign is the clot commonly travels from your legs, right? So if you notice that you have any swelling of your calves or
one calf.
Yeah, one calf, sorry. One calf or any swelling of your thighs, that's when the clot is traveling up your system to get to your lungs. So just take note of that. If you have one-sided calf pain, it could be something serious.
Yeah, especially if you like just came off from like a long flight, or maybe you have like cancer,
or you've been immobile for some time, or you sit a lot. Yeah,
just look out for that.
A man in his 30s came in with a stuck vibrator. The ER doc couldn't remove it, so he called for a surgical consult. The surgeon spread it so wide and pulled it out. He tossed it on the Mayo stand and it was still vibrating. When he pulled his gloves off,
what?
He he splattered me with some liquid poop. I will never forget walking out of that room.
Okay. I don't know much about those sorts of toys and objects, but I think the safe advice would be not to put those things in there, right?
That's a safe advice, but we know people have their own sexual preferences and want to experiment. But all that we can say is the back passage was not designed for that. So
Don't be surprised if it's stuck.
yeah,
And the thing is, if something goes in there, it's not it's not easy to just get back out. It might go in, but to get back out, it's gonna be problems. It's gonna be problems. Yeah. Don't do it unless you have to.
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you need to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Jerk.
Shan, what? Take it away. What would you do? Because I would do the same thing. Just stay into oblivion. Because I can't believe.
Honestly, I'm not gonna blame her. She's not to blame. Guidelines say that we're supposed to instruct the patients how to use the inhaler. That means nobody taught her how to use it, because if she could do that, no. I mean, I understand if she did like half wrong and half right, because people forget. But if she did this, that means nobody showed her how to use it.
I love how much you are so pro patient. I
am
feel-
patient.
I love that. We got a good one here.
Yeah.
Chanel for medical director.
No, but something is wrong. Why did she think that will use it? I don't know. Like, even if you don't know how to use it, that's not the first thing that will come in your head, right?
You said it's not her fault?
But I know what? Some people are slacker. Because a lot of times people would say, oh, I don't know what this is. They say I have this, but I don't know what it is. And then they could go on their phone and type up how to curry chicken or how to use Roku or something. And they can't type, what is diabetes? Some people are just like, no, take charge of your health. That's what I always say.
Yes.
It's on you. It's on you.
Because your phone can be your brain now, and it's everything there. No matter what question you have, the answer is right there. So you have no excuse for going out there and doing things wrong. It's very
Exactly.
simple.
Okay, so that brings us to the end of our episode. I hope you guys are able to laugh along with us, because we had some crazy and ridiculous things in this episode. Don't forget to like, subscribe, share, tell your neighbor and Susie, and tell everybody else. Okay?
Yeah.
Bye.
Bye.